Hey everyone, welcome back to another episode of the 5 in 5, where we ask today's top cannabis experts 5 questions in 5 minutes, answering all your burning questions about cannabis. This episode is extra special because it's October, Breast Cancer Awareness Month. So we're diving into a topic that is so important, and I am so excited to have our special guest, Stacy Bobak. Stacy is a certified cannabis educator and registered dental hygienist. She is the founder of CannaDent and co-founder of the Cannabis Educators Association, EducaNNation. Stacy is also a young breast cancer survivor, so we are going to be diving into how cannabis helped her through managing her symptoms in her treatments and beyond. I can't wait for you all to hear her incredible story. Let's get into it. Stacy, tell us a little bit about yourself. What made you interested in the medical uses of cannabis?
I was diagnosed with breast cancer at the age of 31. My peers and friends and strangers started asking me if I'd considered using medical cannabis. My oncologist wasn't necessarily comfortable prescribing cannabis, but I did have an oncology naturopath who was able to refer me to a medical cannabis clinic who started me off with a few products.
So what made you turn to cannabis during your breast cancer journey? Was there some sort of specific moment or a challenge that really made you start to consider it as an option?
I went through surgery and chemotherapy and radiation, and then was told that I would need to be on this medication for 5 years, which blocked my hormones from potentially causing the cancer to come back. But the side effects of that drug would be aggressive, so much so that my oncologist was prescribing a prescription pain medication. I just didn't feel right about taking a pain med for another medication. So I went to my naturopath and learned a little bit more about these potential alternative options of either addressing those symptoms or maybe even preventing some of the side effects.
So what symptoms did you experience during your breast cancer treatments, and how did cannabis help that? Were there specific products that were more effective for helping that than others?
Some of those symptoms from the medication included joint pain, mood changes like anxiety and depression, sleep and digestion, libido, skin issues. What I found worked was choosing a number of products, so kind of layering the cannabis medicine. For the joint pain, I really leaned into topicals. I started consuming CBD oil regularly to kind of keep my body in balance. I still leaned on inhalation through a dry herb vaporizer when I needed more of a quick onset of effect. Each of those different intake methods had their benefits, and just coming back to the why I was consuming it, and that could dictate when and how much I would take.
So what's your advice for someone who may also be going through breast cancer treatment right now and is maybe thinking about trying cannabis? Is there anything that you wish that you had known before you started using it?
Advice I give to them if they're considering cannabis especially is to connect with someone like me, someone who has taken the time to get educated in medical cannabis and has the ability to coach them and work with them through finding products and dosages that will work for them. I think it's important, and something that I wish I knew more about as a cancer patient just starting out, is that you really have to advocate for yourself. It does come back to that patient to be confident in being able to check in with their body. What symptoms are they feeling? How are they willing to address it? And can they get support from cannabis, maybe with the help of a coach as well, to make it work for them without spending too much time and money going through products that might not be right, or not understanding when to switch a product up.
And lastly, where can people find you to connect with you and learn more about your work?
I started a business that combines my passion for cannabis science with my passion for dental, oral, and overall health. It's called CannaDent. You can find me on Instagram at CannaDent.ca. And if you want to become a cannabis educator, you can learn more about EducaNation at our website. During Breast Cancer Awareness Month, it means so much to me to be able to share my story. I hope to be able to connect with you if you have more questions about my experience.
All right, well, thanks for tuning into today's episode. Stacy's story is such a powerful example of how medical cannabis can make a difference for so many people. And if you want to learn more, check out the free ElionMED app, which I'll put the link to below. You'll find education, you'll find personal suggestions, and you can even book an appointment with an expert clinician in our virtual partnered clinic. Thanks for watching, and we'll see you in the next episode.